Hello, everyone. Welcome. We have another wonderful opportunity to interview one of the co-authors of How Healers Heal. We have Dr. Nandini Sunkireddy with us today, and we're going to just let her talk, share with you her pearls for lifestyle medicine and all things related to health and our future in medicine. Dr. Nandini, welcome.
Thank you, Shilpi, and thank you so much for compiling all the stories and making this book happen. And all credit goes to you. I'm Dr. Nandini Sunkireddy. I'm board certified in obesity, lifestyle, and family medicine, and I practice obesity as well as lifestyle and family medicine in Atlanta, Georgia. So I've been in practice for the last 10 years. But I've been board certified in obesity and lifestyle during COVID, and that changed the way I practice medicine.
COVID changed a lot for all of us. It's changed our lives. So I have some questions. What made you become interested in lifestyle medicine? Don't give away too much. We want people to read your amazing chapter in the book.
Right. So we as physicians and patients, we are sold on the idea that all the chronic, when you are diagnosed with diabetes or when you're diagnosed with all the chronic diseases, you have to take take medications for the rest of your life. And we tend to believe that, like, after taking medications we can do whatever you want, like. And then that happened to my dad, and if you read the chapter you're going to get more details about it, and how it impacted my father's life, and how he was sold on the idea, and he even after taking medications he couldn't follow the lifestyle changes which were intended, and he didn't do the best. So if you want to read about the chapter, that will give you a lot more insights about it. So, and my dad's life kind of made me go into lifestyle medicine. And so think about, like, there is more to medicine than what we know.
There's always more than what we know, right? We the more you learn, the more you learn what you don't know, and there's so much more to learn. Okay, so why else should someone read this book?
So basically, these are the stories of physicians, and a lot of times people believe that physicians are immune and they don't get these chronic diseases, and they take care of themselves really well, but that's not true. We are human and we are stressed out, and with the new changes in healthcare, which we undergo every single day, and with our families, we do experience a lot of stress, and we do get into the more of these chronic diseases. So, and like, these are the stories of the physicians, like themselves, how they transform their life after knowing the benefits of lifestyle medicine. So you definitely want to read this book to know more about these stories.
That is so true. I mean, these stories are just real. Like, they just share the reality of all of us. There's nothing that makes us immune. That is a great point. For someone who is looking to get board certified or learn more about lifestyle medicine, what would you advise them to do?
Yeah, definitely. I would advise to get certified in lifestyle medicine. I'm a primary care physician, and I've been board certified in primary care, and I was doing primary care for years, and I was happy in the place where I am, because my practice is already growing and patients are happy with what I'm doing. But after I got certified in lifestyle medicine, the way I practice medicine has changed. I Even before I talk about the medications, I go into deeper dive into what they're doing lifestyle wise, and it gives me an immense satisfaction about, like, how I can impact the life of my patient. Before, it was more mechanical, where I was just writing the scripts and they were taking the medications, they are happy, I'm happy. But now it gives me an immense pleasure and honor to say that it really changed the way I practice medicine, and it really changed the way my patients are doing with their lifestyle changes.
I love that. I mean, we know from medical school, the first step in every disease is always listed as lifestyle, but we skip over that, go directly to medications. But lifestyle medicine makes us focus on that first step more. It's wonderful. I know you're also board certified in obesity medicine. Can you compare the two for us?
So I incorporate more lifestyle medicine into obesity medicine in my practice. So and I treat obesity like a chronic disease. Like every other disease, obesity is itself a chronic disease. So I blend both of them together in my practice. So that's working out really well. Even though I prescribe the weight loss medications, I emphasize on the lifestyle changes, what they have to do. So no matter you're on medication, no matter you're not on medication, if you had a bariatric surgery, if you didn't have a bariatric surgery, but these lifestyle changes are something which you really have to do.
So they're complementary, so they
Exactly.
complement each other for you, right hand, left hand, kind of
Right.
meeting together and helping you take care of that patient.
Right. And yeah, to be honest, Shilpi, the people who do lifestyle changes are more successful in like losing weight or preventing these chronic diseases, or even it helps even with depression and anxiety, what most of my patients go through. So it is definitely complementary to every field of medicine.
I wonder if they'll merge in the future. Who knows?
Right.
Two colleges. Well, that's great. I love how you're using all of the newfound knowledge, and all of this you did since the start of the pandemic. So these are all like new things you've learned and directly implemented and started helping your patients with, recently. That's so wonderful to hear. I love the one takeaway you have in your chapter. Do you want to share the one takeaway for patients and physicians and healthcare providers of how to change your life, or just important things to keep in mind?
So yeah, I mean, my takeaway is everything cannot be done in a day. So you don't want to get overwhelmed like by trying to do every single thing, incorporate every lifestyle change, what you want to do. In fact, like I mean, whatever, and this I tell to my all my patients whom I see in my obesity practice and stuff. Even a small thing, what you do, even if you sleep for 7 to 9 hours the night before, that's a good lifestyle change. Embrace it. So every single step is important. Even if you had like if you didn't do anything for yourself today, but if you had like plain whole food, even that's a big lifestyle change. So embrace each and everything, and every single step is important towards your goal.
That's wonderful. It's like that famous quote, right? The journey of a thousand steps starts with the first single step. So please keep that in mind. That's a great pearl from Dr. Nandini.
Mhm.
Is there anything else you want to share before we wrap up? And thank you so
Sure.
much for being part of our book.
Right. Thank you so much, Shilpi, for compiling all these stories. And what I would suggest is do read this book. It's wonderful. I mean, these are real stories. These are stories which your physicians are going through, what your physicians are going through, and how they changed their life. So it's wonderful that Shilpi has compiled all these stories. And please do read this book, and please share it with your family and friends as well.
Thank you so much. See you soon.
Bye. Thank you.